Hello, this is a video lesson on the anatomy of the lower extremities. For the anatomy of the foot, it consists of 26 bones that's divided into three parts. There are 14 phalanges, 5 metatarsals, and 7 tarsals. The forefoot consists of the metatarsals and the phalanges. So the forefoot are the metatarsals and the phalanges. We have the midfoot, which are the three cuneiforms, the navicular and the cuboid. That's the midfoot. And the hindfoot is the talus and the calcaneus. There are 2 phalanges in the toe and 3 in the other 4 toes. They're named by location, and the parts of the phalanges, just as we have with the hand, is that we have a head at the distal end, the body, and then the shaft at the proximal. So notice that there are 5 distal phalanges, there are 4 middle phalanges, and there are 5 proximal phalanges, just as there were in the hand. There are 5 metatarsals, which are shown in green. They're numbered by first to fifth, from the big toe being the first one. They form the instep of the foot. The parts include the head, the body, and the base, and the heads of the metatarsals form the ball of the foot. The base is considered the proximal end of the metatarsal. The first metatarsal is the shortest of the 5. The second is the longest. And the 5th has a tuberosity, which is a common site of fractures called the Jones fracture. There are 7 tarsals. The first one is the calcaneus or the os calcis, called the heel. We'll talk about the talus being the most superior of the tarsals. The cuboid being anterior to the calcaneus, but lateral in the remainder compared to the remainder of the tarsals. The navicular is like an upside down canoe, and it's anterior to the talus. And the cuneiforms, there's 3 of them: the medial, the intermediate, and the lateral cuneiforms. The calcaneus is the largest and the strongest of the tarsal bones. It projects posteriorly immediately at the distal part of the foot, and it is at an angle of approximately 30 degrees. It does have a tuberosity, and that is projected posteriorly and inferiorly. It's that portion of the calcaneus. And the sinus tarsi is the inferior surface of the talus and the calcaneal sulcus. So this is the location of where that sinus tarsi is from the superior aspect, and here's the location of it from the side. So the talus is the superior most bone in the foot. It is the second largest tarsal bone. The cuboid is on the side, the lateral aspect of the foot, and it's located between the calcaneus and the 5th metatarsal. The navicular is a flat oval-shaped bone. It is on the medial aspect of the foot between the talus and the cuneiforms. The cuneiforms are named by location. The medial is the largest, the intermediate is the smallest, and then the lateral is the middle size. So they're located between the navicular and the 1st, 2nd, and 3rd metatarsals. The medial cuneiform articulates with the 1st and 2nd metatarsals, the navicular and the intermediate cuneiform. The intermediate cuneiform articulates with the navicular, the 2nd metatarsal, and the medial and lateral cuneiforms. And then the lateral is going to articulate with the navicular, the 2nd, 3rd, and 4th metatarsals, the intermediate cuneiform, and the cuboid bone. The sesamoid bones are located beneath the head of the 1st metatarsal, and so they're detached from the foot, embedded within tendons, and they're a common site for fractures. And so you can see where they would be underneath that head of that 1st metatarsal. Arches. So we have a longitudinal arch, which is a shock absorber for the foot to distribute the weight of the body in all directions. It provides smooth walking. There's the transverse arch as well, which runs from the medial to the lateral, supports and assists in supporting the longitudinal arch. Now we have articulations to talk about. The interphalangeal joints, which include the dips and the pips, are hinge joints. The HTPs are ellipsoidal. The intermetatarsal are gliding. Tarsometatarsal are gliding. Calcaneocuboid is gliding. Cuneocuboid is gliding. Intercuneiform is gliding. An oddball one is the cuboido-navicular is a syndesmosis joint. It's between the cuboid and the navicular. Naviculo-cuneiform is gliding. The talocalcaneal, which is the subtalar joint, is gliding, and then the talocalcaneo-navicular is a ball and socket joint. So looking at the different joints, the two that are odd is that when you're looking at the ball and socket, the talocalcaneo-navicular is a ball and socket joint. Keep in mind that as far as the articulation, that it's important to note that the talocalcaneal is a gliding joint. So here's your just a different picture showing the interphalangeal joints. Here's the interphalangeals in green. In purple, we have the metatarsal joints. In purple, we have the metatarsal phalangeal joints. In yellow, we have the tarsometatarsal joints. And then in between each of the tarsals are all the joints that we mentioned otherwise. The tibia and the fibula. The tibia is the second largest bone in the body. It's on the medial side and it is a weight-bearing bone. The fibula, on the other hand, on the lateral side, it is slightly posterior to the tibia and it does not bear any body weight. The tibia is classified as a long bone. It has three parts: the body, the proximal end, and the distal end. And we'll talk about at those specifically items at those levels. The prominent processes on the proximal tibia, we have the medial condyle and the lateral condyle of the tibia. The lateral condyle has a facet on the posterior surface for the articulation with the fibular head. So there is a joint space here between the tibia and the fibula. The tibial plateaus are going to be two flat, like superior surfaces of the condyles that form smooth facets that articulate with the femoral condyles, and it slopes at an angle of 10 to 20 degrees posteriorly. The intercondylar eminence is located between the two tibial plateaus. It has two peak-like processes called the medial and lateral intercondylar tubercles. So there's tiny little tubercles on the most superior portion of the tibia. The tibial tuberosity is a prominent process on the anterior surface of the tibia, just below the condyles, and it's for attachment of the ligamentum patelli. The anterior crest is a sharp ridge extending along the anterior surface of the tibial body, beginning at the tibial tuberosity, and it is considered the anterior. Here's a picture of the anterior crest right here. On the distal tibia, we have what's referred to as the medial malleolus. Medial malleolus. So it is going to be a large, broad-shaped process. It's actually club-shaped technically on the distal medial surface. We have an anterior tubercle, which is in a different picture, but it's on a tubercle in the anterior lateral surface. And then we have the fibular notch, which is a triangular depression for articulation with the distal fibula. So there's a fibular notch. The surface under the distal tibia is smooth and shaped for the articulation with the talus. On the proximal end of the fibula, so we have the apex. This is the most superior portion. It's a conic projection on the lateral posterior aspect of the head. Posterior or inferior to that is the head. The head is the rounded region proximally that articulates with the lateral condyle of the tibia. The neck is the tapered part distal to the head. Then there's the body, and then finally the lateral malleolus is the last part. It's a pyramidal projection, otherwise called club-shaped on the lateral surface, and it lies 15 to 20 degrees more posterior than the medial malleolus. The ankle joint is formed by the tibia, fibula, and the talus. So there's the tibia, the fibula, and the talus, which is shown here. And we have the mortise joint, which is shown in this picture. That is the opening between the talus and the distal portions of the tibia and the fibula. So looking at the anatomy of the ankle, we're looking here at the intermalleolar plane, which is the plane between the two malleoli, between the lateral and the medial malleoli, does not lie in the coronal plane. It lies at a 15 to 20 degrees from the coronal plane. And that's very important to note because that'll be something that we're going to look at and after we look at the images of the ankle. So the subtalotibular joint is a hinge joint, and so is the tibiotalar joint is a hinge joint. And so that's why your ankle only moves in flexion and extension. We do have two tibiofibular joints. We've got the distal and the proximal. The distal tibiofibular joint is a fibroid joint. It's fibrous movement, and it's a syndesmosis joint, and that's the joint that's at the distal end, and here's a picture of it as well. On the proximal end, we have a gliding joint. So the proximal tibiofibular joint is gliding. The anatomy of the femur. So we've got it's the largest and strongest and heaviest bone in the body. It slants medially 5 to 15 degrees. So medially 5 to 15 degrees. It has approximately the head, the neck, and the trochanters that articulates with the acetabulum. There's the head up here. And then distally, we have the epicondyles and the condyles. So the anatomy of the proximal femur, we've got the head, which is going to be the most medial aspect. It's going to connect to the femoral body. It articulates with the acetabular cavity of the hip joint. The neck is the part that's in green, so that is the neck of the femur is a constricted area near the head, and it is expands to a broad base at the body, and it projects medially, superiorly, and anteriorly from the body. In purple, we have the greater trochanter. The greater trochanter is most laterally located. It's a large process located at the superior lateral portion of the femoral body. The lesser trochanter shown in red, so it's going to be a process at the posterior medial surface of the body. And then we have the two lines and crests. There's the intertrocharic line, which is on the anterior surface, which is between the trochanters, and the intertrocharic crest, which is on the posterior area. It's which is a prominent ridge. The femoral condyles, which are on the distal femur, we'll take a look at those next. On the distal femur, we have two rounded eminences. We have the lateral condyle and we have the medial condyle. And the lateral condyle is smaller. The medial condyle is more distal, which means it's more distal, further down, more inferior, and is larger than the lateral. There's a 5 to 7 degree difference between the two condyles as far as which one is more distal than the other. So for a lateral projection of the knee, the central ray is angled 5 to 7 degrees cephalad to open the joint space. Continuing on, we also have epicondyles. So we have a lateral epicondyle and a medial epicondyle also at the distal aspects of the femur. We have an adductor tubercle, which is a raised area on the medial condyle. It's a point of attachment for a tendon of the adductor muscle, and it assists with being able to view the under rotation or over rotation on the lateral projections of the knee. The patellar surface is a shallow area that's on the anterior surface of the femur, the distal femur, and the anterior surface. And the intercondylar fossa, otherwise called the tunnel, is in the posterior aspect. So that is in the posterior. It's between the two femoral condyles. The popliteal surface is going to be superior to the intercondylar fossa, or otherwise called proximal to that location. There's something called the fibella that some individuals have on the lateral femoral condyle on the posterior aspect, and it shows up radiographically, but it's a small sesamoid bone. The largest sesamoid bone that we have in the body is called the patella. The patella is a flat, triangular shaped bone. It's at the distal anterior surface of the femur. The base of the patella is the most superior portion, and the apex is on the inferior border. The apex has a pointed inferior aspect is going to lie 1.5 inch above the joint space of the knee. It's attached to the tibial tuberosity by the patellar ligament. The anterior surface is rough and convex, while the posterior surface is smooth and oval shaped for attachment to the femur. The knee has ligaments that make it more stable. We have collateral ligaments and cruciate ligaments. The collateral ligaments include the fibular collateral ligament and the tibial collateral ligament. The cruciate ligaments are anterior and posterior. Menisci are fibrocartilage discs that provide stability for the knee and act as shock absorbers that lie on the tibial plateaus between the tibial condyles. They're thin in the middle, and thicker outer margins help to stabilize and cushion movement between the tibia and the femur. And so in the picture shown here, we're looking at the menisci being here and on the posterior viewpoint here, and here on the sagittal viewpoint. So the knee joint also has bursa, which are fluid-filled sacs that have synovial fluid, and there's a suprapatellar bursa and an infrapatellar bursa. The knee joint is formed by the femur, the tibia, the fibula, and the patella, and held together by ligaments. The femoral tibial joint is going to join the two condyles of the femurs with the tibial plateaus, and that's referred to as a hinge joint, which allows us only flexion and extension of our knee. The patellofemoral joint, on the other hand, is where the patella joins the anterior surface of the distal femur, and that is a gliding joint. Okay, this concludes our video lesson on the anatomy of the lower extremity.